Community Breakfast Show today, 28th March 2022. I am your host, Vipora Mshala, and I will be joined by my co-host, Alex Shimba. I hope you're having a wonderful Monday. Today we have something very topical for you. We're talking about shortage of drugs in hospitals. For the past 1 week now, we've seen different views on the same matter. Some argue that the same matter has even been politicized. And so at 7:30, we're going to be joined by Mr. Mubanga Mutale, who is the president of the Biomedical Society of Zambia, to give us from the medical perspective what his thoughts are on the topic of shortage of drugs. And then on the political side at 8 hours, we're going to be joined by Harry Kalaba, president of the Democratic Party, because some argue that the matter has been politicized. Has it indeed been politicized? So we'll have two analyses, one from the medical perspective and the other from the political perspective. So do join us at 7:30 and at 8 hours with your views on the matter. For now, let's go into the morning boost to have a little exercise.
It's a beautiful morning and I welcome you to Morning Boost. I'm so glad that you've tuned in and hope you had a great night. So let's do some workouts this morning and we're going to have a great time. So we're going to start with a warm-up and then make some aerobics movements for today. Okay, ready? Let's go. A beautiful morning to everybody and welcome to Morning Boost. Let's go. Go. And the V step now. Let's go. Last V step. Back to step touch. V step. Let's go. Let's go. And marching. And 4, 3, 2, step touch, go. Bring in your hands now. Let's go. Let's go. Just a quick workout in the morning. Not a full-fledged workout, no. Keep going. And 4, 3, 2, hamstring, go. Four, 3, 2, step touch. Four, 3, 2, and hamstring. And 4, 3, 2, step touch. Let's go. Let's go. Let's go. Keep going, stay at it. Go. Easy basic workouts for the morning. And marching. Skip jump now, go. Let's go, skip. Try this. Even if you feel heavy in your body, you can do this. Let's go. There's always a first time. You may struggle, but it's doable. Let's go. And 4, 3, 2, 1, go. Change now. Let's go. Very easy for a morning workout. Lift your knee very high. Go. Let's go. Stay at it. Stay at it. We're going to bring in a kick now from a knee high to a kick. Go. Go. Let's go. Let there be a blood circulation on your legs so that you don't have that numbness you feel at times. Kick. 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 Let's go, let's go, let's go, let's go, let's go. Straight kicks now. Go. Straight kicks. Go in the sides. Okay. Keep going. Almost done with our 5 minutes workout. Knee high. Try this every morning. It's going to do wonders to your body. Let's go. We're almost there. All right, team. Thank you so much for joining me this morning. This is Isaac Mata, your presenter. I'm going to see you next time at the same time. And have a great day. Thank you for tuning in. Have a great day.
I hope you had a wonderful time exercising like me here in the studio. I had a wonderful exercise this morning and has definitely woken me up. I was feeling a bit sleepy. As you know, the weather is cold. And of course, I have been joined by my co-host, Alex Shimba. Alex, good morning.
Good morning. How are you doing today?
I'm good, only that we missed our morning exercise.
I was doing it all the way from the start to the end. You can even tell from my breathing rate.
I really doubt that.
How is our viewers out there? Have you already greeted them?
Yes, I did actually. And we're talking about the shortage of drugs in hospitals.
Indeed. It's quite something that is hot out there in the public domain, and people have really gotten concerned in terms of the health facilities not having drugs. And also we're going to also unpack the issue of just the recruitment of health workers countrywide, which was earlier announced by the Minister in charge of health, Madam Sylvia Masebo. So we'll get to discuss all those issues. Today, just on the health fraternity, and we get to hear lots of views from you people to call in on the numbers that are scrolling on your screens. And also do join us online where we're streaming live on Facebook. Just search for Camnet TV and it will pop up, and you like the page as well. And so that's what quite exciting things we're going to be having. Okay,
now Alex, do you have everyday health segment? What do we have today?
Oh yes, Dr. Makung Simpungwe, she's going to actually help us in terms of just unpacking the adolescent topic. So today we're discussing who's an adolescent, and just for information's sake, Dr. Simpungwe, she's an assistant director for adolescent health at Ministry of Health. So basically she's going to join us right about now, and pay attention to whatever she's going to say so that we can learn together, actually even from here on this segment. Let's have the health segment now.
Good morning, viewers. My name is Dr. Kakung Simpungwe. I come from Medical Women Association of Zambia. I'm Assistant Director Adolescent Health based at the Ministry of Health. This week we are going to talk about adolescent health. We are going to discuss who an adolescent is, health problems affecting adolescents, contributing factors to some of the health problems facing adolescents. We'll also talk about how young people or adolescents can participate in health programs. And then at the end of the series, we are going to talk about how parents and community leaders can participate in improving the health of young people. So today we'll start by introducing this adolescent. This is a young person aged 10 to 19. So these are young people who are transitioning from childhood to adulthood. So they are no longer children and they are not yet grown-ups. And if you are all aware and remember where we are coming from, this is the same period during which puberty occurs. In girls, there's breast enlargement, commencement of menses or periods. And in men, we see the broadening of shoulders, the breaking of the voice. So these are some of the things you observe in an adolescent. So during adolescence period, young people experiment with a lot of things because they are trying to explore who they are. They experiment with fashion, with hairdos, activities they are interested in their quest really to identify themselves. Who are they? And they really want to be known by something, or they have role models they look up to. When they are children, young people usually depend a lot on their parents. Parents make decisions on what type of food they should eat, the type of clothes they should wear. Sometimes they even decide which friends they should you should make. But during adolescence period, you see a tendency of young people desiring to be independent. They tend to break the ties from their parents. They make their own decisions. They want to decide what type of clothes they are wearing. And they also value opinions by their peers. So during adolescence, it's very, very important for these young people to be associated with peers and to fit in what their colleagues want them to be. So it's very, very important for parents and other people, guardians, to understand that peers value a lot what their friends say, and that really affects also their decision making. Young people are diverse, adolescents are diverse. If we take, for instance, our own setting here in Zambia, we have adolescents who are in school, primary and secondary school. We have those who are out of school, they've dropped out of school, they've never been to school. We have adolescents with disabilities. We have adolescents who are married. We have adolescents who are living on the streets, or street kids. So we have a diverse group of adolescents who require different attention or services depending on which category they belong to. In as much as adolescents may appear to be big in their stature, and sometimes they appear to be intelligent, more technologically advanced than their children, they may have difficulties in making responsible decisions because the part of the brain that controls reasoning is not yet fully developed in young people. So it's not surprising when we see them making decisions or doing things in the heat of the moment just to regret later. Sometimes they engage in activities like gender-based violence, they fight, they drink, they engage in risky sexual behaviors, and all that is just surrounding. They want just to have that immediate enjoyment without really thinking about the consequences of their behavior. But that is how their brain works, because it's still developing, and I think by the end of the 20th birthday, early 20s, most of them have the brain functioning like that of grown-ups. But during adolescence, most of them really need guidance in the way they make decisions. The other thing which is very important for us to remember, during adolescence we see both positive and negative behavior being established, which will really manifest, which will also manifest during adulthood. So behaviors like hard work, being polite, being physically active, even laziness, all those behaviors are actually established during adolescence. Alcohol drinking, smoking, engaging in sexual activities, most of those activities can be traced back during adolescence period. So that is what we talked about today. We defined who an adolescent is, a person who is aged between 10 to 19. We also appreciated that this person is not a fully grown-up person. They are still experimenting the world around them, trying to find their own identity, and some of the decisions they make cannot be relied upon because they may put their lives at risk. We also remember that most of the behaviors that we see even in grown-ups are first established during adolescence. So thank you so much for tuning in today and continue watching Camnet. This has been your doctor, Dr. Kakong Simpungwe. Thank you.
Thank you so much, Dr. Kakong Simpungwe, for that quite vital information on the adolescent. And it's also a reminder to all our viewers that this segment is actually going out for grabs in terms of just advertising. And if your company really needs visibility, this is an opportunity really we are bringing to your doorstep so that you can grab that segment to just put it on your advertising list, so that you can come forth and make your company visible. Yeah, and right about now, we'll just jump directly to our money market for today, updated today, the 28th of March 2022. And we have in the United States dollars buying at 17 kwacha point 73 way and selling at 18 kwacha point 07 way. And South African rand is buying at 1 kwacha point 22 way, selling at 1 kwacha point 24 way. The euro is buying at 18 kwacha point 89 way and selling at 19 kwacha point 26 way. The Great British pound is buying at 23 kwacha 18 way and selling at 23 kwacha point 84 way. Well, that's our money market for today. Any changes you've noticed? Zipporah, from last week we updated.
Yes, the dollar is now in comparison to kwacha is now selling at 18 kwacha in some ways, and then it's buying at 17 kwacha in some ways, and then selling at 18 kwacha in some ways. So that's really on the selling part. That's more like a depreciation, slight depreciation anyway.
Exactly. So that also segment, the money market is also going for grabs in terms of just advertisement, and you can make as well your company visible, as earlier mentioned. So two segments that we're having for advertisement slots, that is the health segment and also the money market. You better take note of that as an opportunity, really. And we just right about now jump directly into our zooming of headlines on our community desk that we actually compiled yesterday's bulletin. So we'll be having a story. You compiled a story about open burning. Can you just maybe elaborate a bit before we just get to the story?
Okay, so basically it's about a habit, in communities. In fact, in Zambia, this is actually maybe more like seen as a normal thing, where you've got some garbage at your house, just pile them up and burn them. And people believe that if you do it in the evening, that's acceptable. But when I was talking to ZEMA, Zambia Environmental Management Agency, so they said either at night or during the day, burning waste openly is a crime, because as you're burning, you're releasing toxic fumes, which also includes carbon dioxide, which also depletes the ozone layer. You're also putting people with diseases like asthma at risk. It can also worsen heart disease and all those things, and it can also cause cancer.
So when we say open burning is bad, or really, what way should now citizens take in terms of an alternative They have what to burn, but how do they burn them?
No, they're not supposed to burn. They're supposed to subscribe to waste collection, so that those guys now who are mandated to legally dispose of waste, they can. So maybe it can be recycled and all those things.
So no burning at all.
No burning at all. Zero burning policy.
Then that should be one of the
and people don't know.
Programs so that people can actually, because we see these things every day.
Every day. I'm sure you've burnt yourself before.
Well, this is TV. We can't face our sins right now. Let's just take a look at that story, and when we get back, we get to review even more.
Open burning of waste is a common act in many Zambian communities and has been normalized by many as one of the quickest ways to get rid of waste without paying. This vice, despite being normalized, is a crime, and punishments for the same are clearly stipulated in the Environmental Management Act. According to the Environmental Management Act number 12 of 2011 and SI number 112 of 2013, one can pay up to 15,000 kwacha or serve a jail sentence of up to 2 years for the same. The vice of open burning of waste has many impacts on human health and the environment. The smoke released from the act has the potential to worsen respiratory diseases like asthma and can also damage crops, as well as contributing to climate change due to the release of carbon dioxide. Zambia Environmental Management Agency ZEMA Principal Information and Communications Officer Mr. Friday Piri has called on citizens to make themselves familiar with the act.
Because the toxic fumes that come from there are harmful to your health, are harmful to the health of the next person. They are harmful to the environment generally. So our first message is always, this is a health hazard and it is an environmental hazard.
Okay.
Right.
So there you have it. That was a story on open air burning. And as you have heard, if you are practicing open air burning, you can be jailed for up to 2 years, or alternatively pay a fine of up to 15,000 kwacha according to the Zambia Environmental Management.
Camnet TV is becoming big and better. You can now watch Camnet TV wherever you are around the world, simply by downloading the Camnet TV app. With Camnet TV app, you only use less bundles. Camnet TV, not just another channel.
And bananas. Working, waiting, this what you've been praying for.
Just apologize for the little disruption there. So that was a story on open burning that we're playing earlier. And we heard from the Zambia Environmental Management Agency, ZEMA, that if you're burning waste openly, you can be charged up to 15,000 kwacha or serve a jail sentence of up to 2 years, or in fact both. You can pay the 15,000 and also serve a jail sentence. So that's something that is really serious, and many people are not aware about this. So there needs to be more sensitization so that people can stop the vice of open air burning. Alex?
Yeah, 2 years is quite
Can you imagine for bathing west you can go 2 years behind
but
that?
The question is who's supposed to be inspecting? Because I must think Zema should be on the ground rather than waiting for people to is it the citizen who's supposed to report the cases?
Yes, yes, we can actually report to the environmental, but then their focus really is more on education, according to the principal information officer. You're saying they are really focused on educating because most people don't know, so have to educate them. It poses as a health hazard, it endangers the environment and all that. So really it's about sensitizing, and then if someone continues despite knowing the dangers, then really that's when action can come in.
Should have asked them if they've sentenced someone already.
I think that's now a case for the Zambia police, isn't it?
Yeah, it can be an interesting story. Yeah, it's talking about waste depora. Even in Chingola, it's quite a serious problem. We're having just the dumping of waste anyhow without following those designated places where you're supposed to, throw your litter and everything. So it's becoming quite unbearable for citizens around that place. This story is compiled by our own Prudence Chota. Let's just take a look at the story.
Improving health care lies at the core center of every country as one way of ensuring sustainable development by bringing up a healthy and productive population. While Zambia has made significant strides in some areas towards Vision 2030 of ensuring good health and well-being for all, the lack of medicine in public hospitals still remains a plague across the country for many years now. When visiting a public hospital, it is not uncommon to be sent home with a prescription requiring that one should buy the medicine, which has become a concern, especially with the current poverty levels, which stand at over 50% of the population, according to the World Bank. A check at some health facilities around the country, namely Kalingalinga Clinic and Chongwe District Hospital, found that this is still the situation.
kulibe bantu wakabwera ku hospital pena ngunu kubalembera pepa kuti wakaku
nizina dwalapo wakutinga potunda paja uchosa mitundo zizochoka ready kuti zili mixed na blood so mine naenda clinic kupimisa nanuza to matenda ya dwala ni yaso but pena enda kuja mkwala sina pesa atiziliko nango nembera chabla tiwende ugule mkwala and mkwala wenze very too much very expensive so that yakutero kuti nkokwani sandrama sina kwanise kugula buno bwino so tenza pepa ku government kuti mkwala mstita ndizirako kutisakira ma clinics zinkaramo zonse zokwana because matenda ena ngo muntu ungafe ngati ndrama za kuvutako so government mstandizireko naenda natengako minkwala ya msanga but no sinini ashua kutika pena vinapola kwa zivamsanga kai sunga pime si vinapite ku lab kuti uzirotuka mwampaso uzapola urusuna pola so mwena mwera ibonde mwena sira nazo kutika pena napola ulokwanyi but mtundo sisi
blood patient wacho wakutali sakira tandizo nubwera kunaba kutumiza kwina katika gule mkwala ni change iri pati manje hapo kuna change oneke kulingana mwita tinjira government mkwala ziyambe kwezeka
nzinaenda kuchongwe clinic kuja na peza kulibe mankwala vancha direct ndwe pachongwe hospital then kuno na peza ko ya mozi mankwala enangu banuza kuti nikagule so simiziva tandizo government kuti ni abwanji mamene wanga titandizile ko si wonse mene bamapesikana drama kuti bakazigula mankwala then ise monga ise tavena ngumsewana wamasiye then tizambo chitabwanji so temporary government kuti tilanganeko pa mankwala.
Reports such as the Auditor General and the Financial Intelligence Center, on the other hand, have been indicating that millions of public funds were pocketed at the expense of the well-being of citizens. In February 2021, there was a discovery of expired medicine that had not been distributed to hospitals by the Zambia Medicines and Medical Supplies Agency ZAMSA, despite health facilities lacking medicine. The citizens have called for all the gaps to be quickly closed in order to restore sanity to the health sector and prevent unwarranted deaths. Zipporah Mshala, Camnet News, Lusaka.
8 November 2019, Zambia launched a polio immunization campaign after confirming a case involving a 2-year-old child in Chiengi district in Northern Province. The child had paralysis of the lower lids and had no history of receiving polio vaccinations. The polio vaccination campaign in Zambia mostly targets children under the age of 5. The vaccination process in Phase 1, targeting 1.2 million children, has since commenced in Lusaka, Eastern, and Muchinga. A check by Camnet TV found low turnouts of parents taking their children for polio vaccination. Camnet TV took time to interview residents of Mtendere compound in Lusaka's Monalis constituency who related the low turnout to inadequate sensitization.
So wakamopita amo vena ngo bapema TV. So wajoya pita amo tandizira tonze TV. And then these days mazimai kube mwana fontina maregerera mwana wake sampika kupolo. Tonze vana timapeleka. So bachachitoya musho chitandizira polio these days ni mangono vana wewadwala.
Because the Ministry of Health is one of the most sensitized one. So sininaziwe na mvela kuri imwe so apati kuri pod. Kuza oloche kuchita advertise ama TV kaida pa social media inabwera kuyangusa che event baenda che bachita advertise pa menepali.
They have since appealed to government to do more sensitization on polio disease and how it can be prevented.
Because ngasimpeka bana polio sozamongala health. Ngambopeka kupolio bana wazambongala healthy kula bwino so tent konke bankwala kuchipatala bangaita health child week tent end tupeleke bana bantu so that okasikula bwino tsasikana ma problem manyumba.
Meanwhile, Lusaka residents have welcomed the move by government of conducting door-to-door polio vaccinations. Blessings Chakwila, Camnet News, Lusaka.
So there you have it. So we move into our next segment. We are talking about the shortage of drugs in hospitals. Like we've seen from the stories we're just from playing, we have heard a number of complaints from some residents of different areas in Chongwe and many other parts of the country. So they're saying for some they're being given the drugs, but then for others they're saying they're only finding maybe part of the prescription, and then for the rest they really do not have those drugs in stock. And we have been joined by Mr. Muwanga Mtale, who is the president of the Biomedical Society of Zambia, here on set to help us unpack the topic. Good morning, Mr. Mtale, and welcome to the show.
Thank you so much for having me. Morning, Zikora.
Good morning, Mr. Mtale.
Hi, hi.
Nice to have you on our segment. Is this your first time appearing on our show?
Yes, and I hope that it will just be one of many to come to
yes,
talk about health issues.
Talking about the first time, maybe you can just introduce yourself on what you do really in the health fraternity so that people as well can know you.
Yes, so I am a biomedical scientist. So my specialty is laboratory medicine. Yes, and I've focused on, my master's is in infectious diseases. I do a bit of that, but my main focus is on how we can improve laboratory quality, which simply just boils down to, are the results you're getting from the lab, you know, of good quality? Are they reliable? Are they accurate? Are they reflecting what is really happening in your body? So I work as a QMS, or quality management systems specialist, so basically dealing with laboratory quality.
Indeed. And you know, confirmed reports indicate that public hospitals, including clinics in both rural and urban areas are quite lacking medicines. Is this what is obtaining from your own maybe research on the ground?
Yeah, I mean, it's no secret, and the Minister of Health has been, you know, on record trying to guide the nation in terms of how we come out of this very, very challenging situation. But also we have to be objective that it's not a new problem. Yeah, the problem has been there for some time and is probably just escalated. The transition from one government to the other might have played a role, but it's not a new problem.
Talking about transition, I'm tempted to ask, how did you really get to this place where almost even the basic medicines are lacking in hospitals? How did you reach here?
Yeah, as I said, problems of this nature are usually a build-up of very small, you know, mistakes that may be made in the healthcare system. So we, in terms of how you as a country are prioritizing what you're spending money on, the systems that you're building to make sure that the supply chains are working as they are supposed to do. So from the time you order your drugs, you have to allow for the time for shipping, and all of that has to be taken into consideration. How you're storing those drugs and medicines or laboratory reagents in my case, since that's my background. So a problem of this nature certainly would have been building over time. And it's quite difficult to pinpoint the exact problem. You know, as I said, the transition might have played a role, but I want to believe that the problem must have started, you know, way back. And in fact, in the laboratory as well, not just drugs, but in the laboratory also, one of the problems that we are grappling with is just the lack of reagents, not having enough reagents, to do the laboratory testing. So if you have been to the hospitals, you're either going to be told that this test is not available, and you may have to do it with private laboratories and all of that. So it's all part of the chain.
And that's a cost, isn't it, for patients?
Yeah, it's a cost for patients because testing in private laboratories can be quite expensive.
Yeah. Let's just remind our people out there, those who are watching us from different platforms, that the phone lines are now open, and you can join us to just add your thoughts, your contribution on this really quite a topic that is of public interest, where we're discussing shortage of drugs with our guest, Mr. Mutale. So you can join us, even on Facebook, where we're streaming live. You can drop your comment in the comment section, and we will be able to review. So we are actually inviting you to this program. Yes, Mr. Mutale, just continue on your thought.
Oh, yes. So now, perhaps just highlighting the importance of this. So we, as a world and as a country, we have targets. For example, you say we want to end TB by 2030, or eradicate TB by 2030. That's going to have to depend on the availability of drugs. If you start your course and you do not finish, one of the things that will happen to you is that you're not going to recover. But there's another big problem. It's that we are going to breed resistance. In other words, the bacteria you're trying to treat will not receive enough power from the drugs because you haven't taken the whole course. And then it's likely to build resistance. What does that do? We may then run out of drug choices in future, where you have TB or any other infection, but then the drugs that are available can't work for you. Why? Because previously people were not finishing courses, and therefore the bacteria or those bugs have built resistance such that the drugs can no longer work. So that's another huge danger. So we'll end up with a situation where the doctors will tell you, you come to the hospital, we test at the lab, we figure out what kind of bacteria or virus you have, or whatever infection you may have, but then there are simply no drug choices. So this is a very urgent matter that the government has to look at and sort out. And we are grateful that the minister has shown leadership in trying to make sure that the situation is corrected. But more importantly, I think we need to look at the systems, like we said when just beginning. Why did we get to this point in the first place? And how can we prevent this from happening again? So we need to strengthen systems, in terms of supply chains, making sure we are managing our resources, our finances very prudently, so that they go to where they are supposed to go. And all this fight against corruption is connected to making sure that the money goes to the right expenditure in our nation.
So really, what could be the problem? I think I remember in 2019 where I covered a story at ZAMSA where there were some expired drugs. So it's not really that the country does not have drugs. Those drugs were expired. I don't know if you're aware about that story.
Yeah.
We're under Dr. Jonas Chanda, the former Minister of Health here. So actually toward that storage there, and we found that there were boxes of medicine that were expired. So expired in store. Really, what could be the long-lasting solution? So it's not really that the country does not have drugs, but those drugs are not actually disbursed. Really, what could be the solution? Some people have been suggesting an overhaul at the Ministry of Health. Would you be in the same position, or what's your response?
I wouldn't say an overhaul in the sense I am understanding your question, but we really have to look at the systems of managing our stock as well. So there is the buying part, right? If you're buying a car from Japan or from wherever, they will tell you will receive this car from between this time and this time. So if you want your car to have arrived before someone's birthday, if you're buying them a car or yourself, you need to factor in that time. So the logistics part of that. But then also the storage. We need to build systems, at ZAMSA and wherever we are managing these stocks, to make sure that we know what we have. Yeah, because like you're saying, the question is, if we needed those drugs, then why did they expire? And did somebody know that something is about to expire so that either they give to facilities or the government sells, as it were, and recovers some money to people who might have needed, or private or whatever, to just make sure they manage the stock? But another question is, did we overbuy? Did we buy too much, more than we needed? Again, those are systems. So what the management needs to do at ZAMSA and wherever they report is to make sure that these systems of stock management and ordering, consumption are strengthened. And I don't know how far your tour went. It's not just again for drugs that people take in. This also happens to other, other commodities like the laboratory. And you may find that this facility does not have what to use to test HB or to measure HB, and then you're trying to make an inquiry and say, okay, can we get some of the reagents or the chemicals we need from ZAMSA, wherever they are stored, and then you are told that no, we don't have. But then, like in your case, which you documented with the minister in 2019, you find that after walking through, you find those things seated. So the management, especially that, we have had new people, and ZAMSA right now is trying to work at the structure that can help it function better. So that's a good thing, which the government is trying to do. And we hope that they are going to actualize those changes to make sure that the system of stock at ZAMSA are working as efficiently as they can.
Let's talk of the impact really on the people on the ground. How are we suffering in terms of this development of about 6 months without medicines? How have been the impact so far in the health fraternity?
Yeah, I mean, it's really common knowledge, although we don't have, the numbers and the direct link that can say, oh, this one died because of lack of drugs and whatever, but it's common sense. The reason, obviously, we want that when you get, you are unwell, like in the morning, soon enough, without taking anything, any foreign substance like a drug into your body, you recover. But that's not the case. By the time the doctors are saying, okay, you need to take something, they know that, okay, it's a drug here that we need to intervene in this situation. So now in a situation where you do not have, those drugs, you really even wonder what may be the point of going to seek health care.
So people start going to maybe the pharmacies, that really also compromises.
That's what they are saying. They are just giving prescription and then they go buy for themselves.
Yeah, and like we were saying, some of these pharmacies can really exploit, and especially where they see the demand is high for the drugs, but the supply, may be low. So some pharmacies are reasonably priced, others are not, and the bottom line is that most people cannot afford, because our development indices tell us that a lot of Zambian people are still poor, and they are living below the poverty daytime line. So they go to these facilities to seek health, and the Ministry of Health has a grand plan, a vision and an aim of taking quality health care as close to the family as possible. So in other words, if you are in Chipulukusu or Kasama or wherever you are, the ministry strives to make sure that they bring healthcare as close to your family as possible. We don't want people to be traveling from Mbala all the way to Lusaka to seek medical treatment. So this whole situation of not having drugs available is not helping the ministry to achieve that goal, and I think this is why the minister has been so ardent on making sure this thing is resolved, bringing in partners, both private as well as government, to make sure that the problem is resolved. But then we're looking at healthcare as a whole. Like I said, from our perspective as laboratory experts, when you come, let's say you have diarrhea, there are so many things that can cause diarrhea. So it's the duty of the laboratory to figure out what's causing diarrhea. Is it fungi? Is it bacteria? Is it a virus? and what type is it. So to identify the exact type of bacteria or virus or fungi that's causing that problem. Why do we do that? The next step we carry out in the lab is to do what we call drug susceptibility testing. So when you say, okay, this bacteria is Staphylococcus aureus, and then you now subject it to drugs that it's going to respond to, so that you report to the clinician who is attending to the patient and say, okay, the drugs that will work against this are these. Again, you know, after spending all those hours and days as a laboratory person figuring out what this person is suffering from, and then also recommending the drugs that are going to work, but then the patient goes there and they don't find the drugs, what really is the point? So the problem is really, really big, so it's not prudent use of resources all around the healthcare system. That's why we need to make sure that it's sorted. Information coming from the laboratory, radiology, and whatever can be used to treat.
Talking of the government direction in terms of just ensuring that the health sector is quite efficient and also effective. We've seen the number of developments that have occurred in the ministry, like, for instance, the abolishing of some boards and management, especially those under ZAMSA. Do you think there are people deliberately, you know, jeopardizing the processes so that we can be affected as the people? Those whose intent do not just mean well, considering the development that happened in the ministry.
Yeah, in terms of, we cannot accuse people here without evidence. Yeah, so if the leadership at the Ministry of Health or the minister has seen that there needs to be some change of leadership here and there, then we definitely support that if that's what the problem is. And really, in a sense, John Maxwell said everything rises and falls on leadership. And I do agree with him. An organization cannot go beyond the capabilities of its leaders. So in order for us to sort out all these problems we are saying, we need to, to change the leadership where we can. And by the way, this is why the Zambians felt that they needed to change the leadership. Why? Because they were connecting the problems they were suffering from to the people leading them. So leadership we place a very high premium on leadership. So if the minister thinks that this board is not doing its job, I need to put in people who are doing the work, then by all means we support her, as long as those people are held accountable and they deliver, on the expectations of the Zambian people whom they are appointed to serve.
All right, so maybe let's also talk about the recruitment process of is it 11,000 health workers, and maybe really just to begin, what role is the biomedical society playing in this recruitment, and maybe how does the society actually benefit citizens?
Yeah, our role in this case, first of all, we have been advocating, as a Biomedical Society of Zambia, we have been trying to advocate for the importance of investing in laboratory systems, including employing adequate and properly qualified personnel. So we have been engaging the ministry, and the ministry has been very, very supportive and proactive in reaching out to us. They reached out to us and say, you guys, who hasn't been employed, what kind of cadres are needed, and so on and so forth, so that we work together. So the Biomedical Society of Zambia advises the ministry and works with the ministry in terms of how the structure can be organized, the laboratory structure for efficiency. And in this recruitment process, there's high unemployment in our country. So a lot of people might want to actually jump onto this bandwagon and get employed, even if they are not qualified to work in a clinical or medical laboratory. So the Biomedical Society of Zambia is there again to work very closely with the Ministry of Health to make sure that the right cadres are employed. Because if we employ the wrong kinds of people, the wrong kind of people in the laboratory, then your life and my life is in danger. Remember, I said that the clinicians are acting on the information coming from the lab. And you guys already know that we are still in a, you know, in the COVID-19 pandemic. It hasn't gone. The laboratory again has come to the fore. The pandemic has shined the spotlight on the importance of the lab. Why? Because all the diagnosis and confirmation of COVID has to come from the lab. Yeah, when I was driving to this studio, I was listening to news. There's an outbreak of COVID, you know, in China, Shanghai, one of the biggest business hubs in the world. And the government has imposed a lockdown in there so that they can do mass testing. Again, that's the lab. Yeah, so that's why we have been calling upon the government. We have been working very closely with the ministry to make sure that the laboratory is invested in. So right now we have the COVID-19 pandemic, but we do not know what else, you know, is may come. Yeah, and the question is, are our laboratory systems ready to respond to that pandemic? I'm not quite sure I can confidently say yes. So there is need to do more. We welcome the move by the government to employ more people. In fact, they've given us quite a number of, you know, slots as laboratory personnel so that we can improve the systems. We are moving away from guesswork medicine to evidence-based medicine. We need to know, before you get the drugs we are talking about, what really are you suffering from? And 70% of that information comes from the lab.
Not the previous friend, how are you feeling? Are you feeling hot?
Yeah. Or it's paining when I touch, then say, okay, stop touching. You know?
Yes.
Okay, so let's talk about the number itself. 11,276 health workers are segmented in different expertise and all that. What does that figure mean to you as laboratories?
Yeah, so we, like I said, I want to congratulate the government, you know, on taking this commendable measure of alleviating the staff shortages. Because as we were just saying, an organization...
This is considering that we have about more than 75,000 deficit in our own country in terms of health practitioners.
Yeah.
So is this quite adequate enough?
Obviously, it may not cover all the needs, but it's a great leap towards where we want to be. You may be aware that employment was frozen for some years, maybe beginning late 2016 or 2017, and to have these numbers gobbled up all at once is something that's really commendable by this government. What do the numbers mean? One of the things, again, we want to congratulate the government on is simply the fact that now, more than ever, we have seen a balance of some sort in terms of saying, okay, let's get nurses, let's get doctors, let's get pharmacists, let's get laboratory personnel. In many years back, you know, over time we have been seeing employment of people who are usually seen at the front line, quote unquote, so nurses, doctors who are usually seen. Yeah, you guys don't see the laboratory. And as I'm talking, they are busy in the lab figuring out, is this COVID or not? Is this
to some they don't even know they exist.
Yes,
in our country. It's something foreign.
Yeah, and this is why we are hoping, as part of our strategic plan, to educate the masses on the role of the lab in their lives and to the nation. We want to start a consistent TV program where we can discuss these things.
You should consider Camnet for that matter.
Yeah, we will too. Yeah, so the numbers, the good thing is that although it does not cover all of the needs that we need, or that we have rather, at least it's well balanced, and the laboratory has been given a considerable number of laboratory technologists, you know, about 533. However, we would have wanted to see more of biomedical scientists also, so these are staff at degree level who are only given 44 slots. But we are still working with the Ministry of Health to see how we can beef up these numbers also of scientific staff so that we complement each other.
So 44 countrywide, those are degree level. And
degree level, and then diploma, it's 533.
Okay.
Yeah.
Okay.
So that was a very welcome.
So what's the deficit number that we are having currently after the 44 gone in the system?
Yeah, so with the new you know, hospitals being opened up and some new institutions coming up, I really cannot tell you a figure. Yeah, I would rather first ask, you know, around with the Ministry of Health and the new programs that have come on as well. Yeah, so, and then it also depends on the size of the hospital or the lab you're dealing with to say how many scientific personnel do we need here and how many medical laboratory technologists or the diploma level technologists are there. And like I said, we want to make sure that these slots go to the right people who are trained to work in medical laboratories. Because as you guys may be aware, there are so many courses that may have laboratory at the end, and we do not want the ministry or ourselves to get mixed up and then we get the wrong cadre. All of us are in danger. The information that will be coming from the lab will not be reliable, and the decisions that will be made on that information, whether to lock down the country or not, will also not be reliable. That's why the Biomedical Society of Zambia is there to work very closely with the Ministry of Health to make sure that without fear or favor, we employ the right cadres. Without politics, we employ the right cadres so that this well-intended intervention of alleviating staff shortages yields the maximum benefits it's supposed to.
Okay, earlier you mentioned about, is it for biomedical scientists?
Yeah.
So really, maybe just to break it down for people who are out there, what really do biomedical scientists do?
Yeah. So biomedical scientists, as I said, I'm a biomedical scientist myself, and these are, as the name suggests, the key thing is that they do laboratory work that has to do with medicine. So it's laboratory medicine. So doctors deal with clinical medicine. They see you from the outside, imaging and whatever. And then we as biomedical scientists look at disease from the molecular level, at the very basic cell, even sub-cell, or within the cell, what's going on for you to be swelling like this. Is it cancer? Cancer is diagnosed in the lab. So something can be swelling, it may be cancer or it may not be cancerous. So it's us to figure out and then work with the clinicians or the doctors who are seeing that patient to say, okay, this is what's causing this. Or like I said, the diarrhea may be caused by so many things. It's the biomedical scientist's duty, it's the medical laboratory technologist's duty to figure out, okay, what's causing this diarrhea. So the clinician will say, okay, patient came in like this, it's been 4 days, whatever. Then you get that information plus what you're seeing in the lab, put it together, then you write a lab report, which the doctor now uses, plus other tests that they get. And as I said, about 70 to now even almost 100% of all medical decisions rely on laboratory information, and it's biomedical scientists and it's medical laboratory technologists who are behind generating that information.
Okay, let's just have a look of one of the stories.
And then you can, there are also branches, research, you can do research, even in pharmaceutical industry as well. There's a lot of space for biomedical scientists to work. You can teach in institutions, medical students, biomedical students, and other people who are doing health sciences, because we cover quite a wide range of disciplines.
As we run quite out of time, you will come back after this story to just give an opportunity for Mr. Mutale to give his concluding remarks. Let's just take a look.
President bakamba kuti inde mankwala akazifika mvipatala vonse, but naise takondwera nda monga bantu tikatwala tikaenda mvipatala amakamba ti mankwala kulibe pakina kupasa panado achitokuza ti akulembera cheka pepa tikakuleni maiti zakula bwanji tilipendera mairo pakuti chamene tibwerera ku hospital nikutitandiza nitandizo kaye nishitilie ndalama zaswaitawera ku hospital, so zaswa chamene timabwerera ku chipatala. So tifuna kuti tandizo monga iyo mwakambira president kuti mankwala zambopezeka manje awe se takondwera tambwa bwino. Muntu aliyo sazambera bwino ndawe nango upeze kuti uyende ku hospital ufira pa gedi pakino ufira palaeni na mankwala kasi mulibe muchipatala kungo zitwala tia kuti nikangofira tia pa gedi akanike muchitene mmochali kambaka kuti naenda ku hospital.
There have it. We are discussing the drug shortage and also recruitment process of health workers currently which is going on in our country, and we've been discussing that topic with the help of Mr. Mubanga Mtale, who's actually Biomedical Society of Zambia president. And right about now, as he gives his concluding remarks, we'll be joining in another segment with another guest that will be discussing further on this particular topic. Mr. Mtale, just your concluding remarks on the topic.
Yeah.
Maybe in a minute or so.
Oh, yes. So first, as I said, I think the issue of the drug shortages have been building up over time, and the new leaders that we have inherited that problem, and leaders are there to move people from point A to point B. Leaders are there to solve problems, and we really wish the Minister of Health and His Excellency, the President, Mr. Hakainde Hichilema, as they tackle so many problems at different fronts. This is just one of them. And then, as I said, we as laboratory professionals are also looking forward to this going away, because our work interfaces very much with what's happening in the wards. As I said, if we diagnose a disease in the lab, the hope is that this person is going to be treated, and usually it's drugs or surgery or whatever intervention. So what really is the point of us doing those things if we're not going to have people get the drugs? So again, it's to commend the leadership of the minister. I think she has demonstrated leadership on this issue and been very forthcoming with what the next steps are. We hope that it gets resolved as quickly as possible. And then we hope that as part of improving health and taking health care as close to the family as possible and realizing the goal of universal health coverage, we will welcome the recruitment of health staff, among whom are laboratory professionals. We hope that more can be engaged, and we'll continue working with the Minister of Health to see that happen. Thank you so much.
Well, thank you so much, Mr. Munda. Just a quick one. If I want to become like you in future, what do I need to go through? How long does it take me?
Yeah, so like I said, we have diploma programs. So we've got a number of schools. There's Ndola College of Biomedical Sciences, Evelyn Horn College, Kankata, there's Levi Mwanawasa, and some others that I may not go through due to time. Then degree level, you've got UNZA, you've got Levi Mwanawasa, you've got South Valley, you've got the Copper Belt University. So those take about 4 to 5 years. Yeah, and then you do your attachment in the hospital. So you need to first rewrite your sciences. How are your sciences?
All ones,
yeah.
Trust me.
Yeah, so we encourage
one of those.
Yeah, so we encourage grade 12 school leavers and all to come. And like I was saying, these schools, we review their curriculum to see what's being taught. We work closely with these schools and the Biomedical Society to make sure that when people leave those institutions, they are fully baked to work and not become a danger. They become more dangerous to patients than diseases themselves. So we want to make sure, and this is why I said, you can't just come and say, no, I also want to work in the lab because I did this and did that and did that. We have to look at that and scrutinize and whether it meets the standards.
Great. Thank you so much, Mr. Mtali.
Yeah, thank you very much for coming through. It has been very informative.
Yeah, thank you so much, Zipporah. Thanks, Alex.
Yeah, so just take a short break right now, and then on the other side, we're going to be joined by Mr. Harry Kalaba, President of the Democratic Party. So do join us on the other side, so let's just take a short break.
Camnet TV is becoming big and better. You can now watch Camnet TV wherever you are around the world, simply by downloading the Camnet TV app. Camnet TV app, you only use less bundles. Camnet TV, not just another channel.
So we were joined by Mr. Mbwanga Mtale, President of the Biomedical Society of Zambia. Very informative, especially from the laboratory perspective, where in Zambia, mostly in most public hospitals in Zambia, you're not really diagnosed from the laboratory perspective, but really he's saying he's looking forward to a time where for each and every illness that you go to the clinical hospital for, first it has to pass through the lab to determine what really the problem is. Alex?
Most importantly, there should be drugs to give you afterwards. And this is why we're bringing this topic closer to home so that we can discuss it together as also our guests will be joining us. And in efforts just to, to investigate what's going on in the ministry, concerning the drug issues and also the recruitment processes, the head of office and the President of Republic of Zambia, Mr. Hakainde Hichilema, did visit the ministry last week, and we did compile that story. Let's just take a look, and when we get back, we'll be having Mr. Harry Kalaba in our studios.
The reported shortage of medicines in some health facilities has continued to attract public scrutiny, with some stakeholders alleging that the United Party for National Development administration has failed to live up to its campaign promises. Thursday, Zambia's Republican President Hakainde Hichilema visited the Ministry of Health headquarters in Lusaka to understand the reasons behind the shortage of drugs which are essential to humans. After 2 hours of a closed-door meeting with officials at the Ministry of Health, the President addressed the media and has attributed the shortage of medicines to a number of issues which he says some have been sorted while others need interrogations.
The good news is that talking to the provincial medical officers, they are all confirming, they've confirmed that, and they have purchases when those purchases are needed to close a gap. That could be temporary. What do I mean? Particular drug type, not available from the floors at the center. Remember, we are organizing the center as well, and with the new leadership. I'm very pleased with the interaction we had with the new leadership at SAMSA. What used to be medical is now available, and then the purchase can take place as and when the particular drug line or type is not available from the central floor.
The President also says the former Patriotic Front administration caused a mess in various sectors which his government is trying to solve.
There are legal issues in the health sector as they are in different ministries, different sectors. There are legal issues. We all know that the country was not run well. We know that. We must accept that. Instead of fighting this fact, we must accept and start from there. So there are legal issues of maybe amounts that were owed to suppliers in the past. They're there. There are legal issues in the fuel, I'm just grabbing a little bit, crossing over, of unpaid bills. What we're doing is unblocking these legal issues, but at the same time making sure that going forward we don't create new inefficiencies in the way we run.
And President Hichilema, when asked about why there is a delay in the recruitment of health workers, the President was quick to mention that his administration has been undertaking audit in whole health facilities to appreciate their needs so as to understand which areas need health workers.
Looked at the issues at hand and made sure that we don't continue with the recruitment process without dealing with issues that may result in maybe misapplication or misallocation of the medical staff as required on the ground. So again, we spend time to look at what's on the ground, what health facilities are on the ground, what do they need most.
The President has since assured the country that he will continue to visit all line ministries, adding that his job is not to sit in his office but serve the Zambian people. Prudence Chota, reporting for Camnet TV News.
Welcome back. And that was a story when the president actually visited the Minister of Health to actually just establish what could be going wrong in terms of drug shortages and also the recruitment processes that is going on in the country. And we've been joined by the President for Democratic Party, that is Mr. Harry Kalaba. Good morning, sir.
Good morning, and how are you?
I'm doing fine, and welcome to our program.
Thank you so much.
Yes, good morning, Mr. Kalaba.
Thank you.
Welcome.
Thank you so much.
So just to get right in directly into it, you know, been having this program before you came in with Mr. Mutali, we shared quite a number of things, but due to the fact that you are representing the population which is quite keen and interested in knowing the fact that how did we come here from your lenses, and maybe you can even give us more information how we reach the fact that we don't have medicine or hospital, clinics and health centers in rural areas and urban areas for over 6 months now. From your view, what led us to this point?
I think basically what has led us to this point is that we have not taken time to take seriously the issues that are happening in the health sector. You know, it's a very sad development that for the first time in the history of our country, we have gone for 7 months without procuring of medicines in hospitals. And this has not gone very well with our populace. I have taken time myself, as you know, last time I was with you. I went to Chilenje Hospital, I was in Kanyama Clinic, just to see for myself the situation of why medicines are not in those clinics and hospitals. And indeed, it is true. There are no, there's no medication in the hospitals. One of the biggest challenges has been that I think the New Dawn government has elected to do some forensic audit on the procurement process of medicines. But that, as it might have been, I think for me, it should have taken them time to do it in tandem. While they were doing the audit of the procurement process, they should have also taken time to continue the procurement of medicines. Because right now what's happening in hospitals is that people are only being given prescriptions. You only go to the hospital to confirm at if you're well enough. And go and look for medicine for yourself. I think we can't reduce our people to that kind of situation. Like, for instance, I was at Chilenje Clinic, where a mother with a 2-year-old daughter who was sick, and they could not access the medicine because they didn't have amoxicillin liquid for children. And so they told her to say, you get these tablets for adults, go and smash them and make the liquid for the child. I think we can't do that. I think that is very detrimental to our country. So we have reached this far because of a lack of depth in the understanding of our health situation, and that the New Dawn government should have done better if they had taken time to allow the process of procuring of medicines, as well as that of the audits which they're doing to run side by side.
Okay, what impact does the transition from the previous regime to the new Dawn administration have to do with the medicine? Is there any correlation from your view?
The only thing which is happening here is the question of procurement. It's deals, just deals. Who is going to be bringing in the medicines? And unfortunately, in the pharmaceutical world, if you are bringing in medicines, you know, they are somehow tied to the person that is bringing in the medicines. So that in case of anything, they are able to trace. So that's the problem that they have had. They want to kick out those that were bringing in medicines before the New Dawn government came into power, so that the New Dawn can put in their own people to begin procuring the medicines. But that has not really not worked because I think they have been having challenges in ensuring that the new ones whom they want to bring in medicines bring in the medicines. As a result, this is a situation that we have ended up in. You know, when two elephants are fighting, naturally the ones that suffer, the grass is what suffers.
As the saying goes. Yeah. I mean, for over 57 now, as the country clocked 57 years, do we really need to be discussing this issue of drug shortages and health fraternity being affected by various issues.
In fact, the country is not clocking 57, we're clocking 58 years this
yes,
year.
2022, yeah.
2022 in October. And look, I think for me, we should not be talking about issues of drugs. We should have already put in place what they call maybe some kind of a template. We know what we need, the quantities according to our population, according to the densities of each demographic. We should have already known. But typical of African politics, when a new regime or new government comes in, they want to disrupt what was going on and just seem to be doing something. And that is the problem that we have had. And that is why the health sector is affected. Government has not procured medicine for 7 months. Now, to stay for 7 months without the procurement of medicines, I think it's a catastrophic situation of very huge proportions. That is why it's important that sometimes, even as you're doing your forensic audit, which is a welcome venture, you also need to be realistic and understand that abantu balewo come hospitals as a result of no medicine. Imagine, even if you tute, they put the plaster of Paris on you. You have to buy. There's nothing like giving you. No, you have to buy. And if you don't have, you stay like that for a long time without being attended to. I don't think we should allow that situation. And to the new Dawn government, my appeal has always been, I think people voted for you to take over government. I think stop this talk of PF. They haven't done that. You are the ones who are in government. So let people stop buying plaster of Paris. Let the people stop procuring medicines from pharmacies, because it is the inescapable responsibility of government to buy medicines for its citizens. I mean, health is wealth. There is no nation that can prosper without being healthy. So we need to be a healthy nation for us to be a healthy nation, a wealthy nation. But as things stand, we are surviving by God's grace. And we can't be putting God's grace every time on trial. No.
And maybe what do you think with the high poverty levels in Zambia, what does this mean for the ordinary citizen when they go to the clinic? For example, I can say maybe for myself, I witnessed the same. About 3 weeks ago, I was taken to Mtendere Health Center, and really not even Panadol was there, the whole list I had to buy. So what does this mean maybe for the ordinary citizen, given that we have poverty levels which stand at over half of the population?
It means that the ordinary citizens are being condemned now to dying on their own. Because the reason why governments comes in place is to help both the rich and the poor. Both the civilized and the uncivilized. Both the educated and the uneducated. Now when you have a situation where government has neglected the poor for the last 7 months, I think it's a situation that calls for a lot of attention. And I saw that thing you are showing on your TV here of the president visiting Ministry of Health. People who are meeting, you should have asked him, what is this drama for? What are you doing here? And there was a lot of hype around it. No, the president has come to work. He's now working for Ministry of... Look, if you asked me, I have been a civil servant before and I've been a minister before. There's what we call folios on the files. When you're working on something, there's folio 27A. A permanent secretary will refer something to me, we'll call it folio 1. When I respond to him on the same subject on the file, it will be folio 1B. And then it goes back to PS with instructions. So if you say the president went to work, what files was he working on? What folios was the president working on for you to begin saying he was working for Ministry of Health? Because the way State House is, it is connected with ministries. The president can be able to talk to his ministers via Zoom, and he can be talking to them on the screen, and he can address them. I mean, that's a system that was put in place some time back. He can talk to ambassadors from outside on the screen and talk to them. So even what he did that day, if it was not for politics, then I don't know what it was for. Because the president, if he really wanted to find out the situation, as I said earlier myself, the situation in the hospitals, His Excellency the President should have gone to Chilenge Clinic. He should have gone to Mtendere the way you did, or go to Chilenge the way he did, or go and... That's when you appreciate the situation. not academics of just living state house where there's aircon. Again, you rush to another office where there's aircon, and they want to be telling us that we are addressing the situation, and what was on social media was just talk. I think that kind of politics must come to a close, especially politics around the health of our people. We must minimize that, because this is a question of life and death. And there are people who can't even afford to buy aspirin. There are people who can't afford to buy Coartem. There are people who can't afford to buy the basics in our health centers. And so it becomes the responsibility of government to ensure that these things are put in place. Now, to stay for 7 months, without government procuring medicines, how many people's diseases have grown as a result of lack of attention in those 7 months? How many people could even have probably died as a result of not being attended to because there was no medicine in the hospitals? How many people's legs have gotten swollen, more swollen than ever before, because they could not put the plaster of Paris today? You see, it is these kind of things, this level of negligence, which we want to eulogize, and then you are here, you are saying, no, he has worked, Kalaba is just talking, he's just jealousy, he's what? Jealous for what? Jealous for what?
Okay, but when you comment to ask as a follow-up question, how would the DP then handle this situation differently?
Look, as I said earlier on, my colleagues, I said, the best thing to do when you come in government, this is the mistake that was made in 1991. When the MMD took over government, from the UNIP government, they almost obliterated everything that they found that was done by the UNIP regime. That was a problem. In 2011, I think President Saita was prudent enough to allow some of the programs to continue, like, the 7th National Development Plan was already underway. He continued with it. He found the link Zambia 8,000 on his table. He continued with it. So it's a question of understanding that you can continue with a system to a certain extent until you introduce a new system. You can't chase vendors Zepora from the streets before you find where to place them. It doesn't work that way. You need to find a solution. You just can't go in a home, in your own home, you say, inenshire for akapenda. Saule for akapenda. Now ushitenkoko. Now ushta inama. Have you brought something else? Have you given us a choice? So that's the problem. And you just can't just do away with the system before you bring in a new system. And that's the problem that we have had. That we think by being new, you have to get rid of everything that was done in the past. Not everything that the PF did was wrong. Some individuals could have been wrong. Some individuals could have been problematic. But maybe some systems which we want to take to overhaul could have been okay. Maybe they just needed 1 or 2 adjustments. So this is what happens when you have a situation where people want to show that they are working. If the Ministry of Health, without any, if government, the new Dawn government, without any research, quickly rushed and introduced free education, why, if the new Dawn government, without any research, quickly rushed and kicked out this mineral royalty tax in mines for a period of 5 years, why didn't they also do the same with our medicines in hospitals? Why didn't they say we continue with these people who are procuring these medicines until we find suppliers who will be registered there to bring in medicines? But they were in a hurry to begin bringing in their friends, to begin supplying those medicines.
Mr. Kalaba, we have a call.
Okay, just to add to your thought in terms of just replacing entity.
But you see, also when I have a call, you should let me first finish my point. Don't just say, Mr.
You can talk and then you finish. Okay,
Mr. Kalaba, just adding to your thought, really. We've seen efforts really by government to handle the health situation, and we've seen sometimes earlier on abolishing boards and management of subsectors, entities involved in the regulatory and distribution of drugs, like you earlier alluded to. Really, is that could that help really going forward, making sure that those people who are managing certain entities have bought into the vision and they are aligned to the agenda that the new administration has come with?
It's not a question of being aligned to the vision or anything. I think it's a question of having a system that is well-grounded, a system that is well-researched, so that regardless of whoever comes in government, regardless of whoever takes over the regime, they'll be able to continue from where their colleagues stopped, especially if the system is transparent. That is why we need to have a system that is watertight, a system that will allow our people to continue accessing the basic services of government without disruption. Because as you have seen now, I mean, the challenge that we have had is that there's been a huge disruption. And to recover from this disruption will be very problematic, because...
Don't you think there will be people in the system who might be sharing loyalties and, you know, jeopardizing the whole process?
Look, I think the procurement system is not done by politicians. The procurement system is done by civil servants. And all those pharmaceutical companies, as connected to government as they might have been, they went through a process, a legal process. And that's how they managed to begin supplying those medicines that they were supplying to the Ministry of Health. So, the issue is, if you find that you come in government and you discover that though they might be doing it legally, these people, but it's like their loyalty was with this regime, and as a result of their being loyal to this regime, it was affecting us, then you can effect some kind of adjustments. Okay, what is wrong? Even if Hari Kalaba became president tomorrow, what is wrong if it is a UPND company supplying medicines, or a UPND aligned person who won a tender and is supplying medicines to government? What is wrong with that?
So
what is wrong?
You can't change that.
If the person is following the correct methodology, the correct prescription from the authorities at Ministry of Health, if the person has won the bid, these are the kind of politics we need to graduate from. At the end of the day, I have always admired what is happening in the politics, where once you become a president, you cease to be a president of any political party. I think that's where we should go ourselves as a country. Okay. Because it is this small politics that take away from us. It is these small politics that make Zambians suffer for 7 months without medicines, because you discover that probably the people who are supplying medicines to government were PF aligned at the time. And therefore, to teach them a lesson, we need to grab these contracts from them and give them to those that are aligned to our political party. If they are Zambians, regardless of where they are coming from, they should not be punished. They are Zambians. And if they qualified for a tender, let them go ahead. We don't want to see what we are saying, shoddy works being done simply because now for Tenge, a political party, that's the qualification. The qualification is, if they are looking for a grade 4 in construction, are you in that category? If you're in that category, fine. Regardless of who comes in, it's okay. But you can't subject a country to 7 months without medicine, because the ones who are supplying the medicines were aligned to a particular political party. That is wrong. That is not
so
permissible.
the shuffles and the abolishment were not necessary according to you?
No. Look, we're talking about the procurement system, which has been going through a rigorous process by government. And my argument, our argument, has been these things should have been moving in tandem. While you are doing the forensic audits, you should have also allowed the procurement process by those who are allowed to procure certain medicines to continue supplying, while you want to make that transition without disrupting the process. What has happened is that for 7 months, government has not been able to procure medicines. They have allowed certain deaths to happen, which should not have happened, as a result of negligence. You don't buy medicine. You just sit at home and say, first of all, we need to change this system. That is where the problem is. And it's not a question of changing when you become, when I become president, one day, I will not say Madam Maseo should continue as Minister of Health. Because Maseo wali kwa nefa UPND valia. Wala kubafunya, and then you bring your muntu abatishiwa bwino and continues with the policies that
well, given the fact
propagating.
that Madam Masawe is not around, we'll get to another segment that we actually attach to this discussion, the issue of recruitment. Looking at the fact that the numbers are showing over 100 health workers in deficit in terms of the demand, people we need to be in the system. But then recently the ministry announced about 11,276 health workers to be recruited in the system. What does that mean to you, the number 11,276? Is it adequate enough?
Look, I think the number 11,276 is not a bad number in the health sector. I think that can make a huge difference. But also the other day I was harangud on, I commented on President Hichilema's page. And I said the president was saying 11,276 applications, application fees 0. And then the president said connections 0, something 0. So I wrote to the president and said, Mr. President, I think, why don't you wait for the recruitment process to finish? When it finishes, you'll be able to tell whether those who got recruited did not need any connections to be recruited, or whether they didn't need something, they didn't need to bribe anybody for them to be recruited. Why are you celebrating? But you're already celebrating at the leg is before you.
They've
it
put
doesn't work
things
that
in
way.
place. It's a
You are talking to somebody who has been in government before. And sometimes,
for instance, let me give you an example.
This is a very sensitive thing to say. Sometimes you can advertise 11,276 jobs. How sure are you that the monies for the 11,276 jobs will be available? What is the position of the International Monetary Fund? Minister Msogotwana was giving a ministerial statement. Was it on Friday? I listened to it, saying that this deal will go through by June this year. The question I was asking Minister Msogotwana was, you have not even told us the conditionalities of acquiring and accessing that loan. Will the IMF allow government to employ the whole 11,276 employees? That's why I had further asked in one of my Facebook postings, I had said, why can't government also help us? Because they have said the recruitments or the applications should be done district by district. So why don't they help us to also show each district how many have applied and how many have gotten recruited in line with the 11,276 applications? So to advertise is one thing, and to have the recruitment exercise of everybody 11,276 is another.
It was discovered through the ministerial statement that Madam Masawe did give 25 of March 2022 that there are certain misnomers that are happening in the system, considering the figures that are coming to the ministry and those which are obtained in the ground. Do you think then going forward that they should be, that okay, what they have done in terms of categorizing this application process in terms of district, and also providing a system where the district commissioner can have a copy so that everything should be transparent in the process? Do you think this is what has sealed kind of a system and we don't see to... So
when the DC has a copy, then what?
According to them, this will be showing that someone has applied, because recently or maybe previously we'll be having situations where someone applies and then they are being told that we didn't see your application form from the directors in these respective... And
then when the DC has a copy, is going to show them the copy
as evidence. So from my view, I'm seeing a situation where this system is quite studied and they have sealed those loopholes. Don't you think so?
I think we need more popcorns here.
Okay, how better, maybe how can the system be made more secure?
And transparent.
Look, normally the system of government must be secure in as far as it should be, because government has got its own systems that protect it. And I speak as a former civil servant for 10 years. I went through myself an interview I went even through an exam at NIPA to enter the civil service. Now, when the system of government is not interfered with by politics, the system has got enough rules to allow candidates go through as you have applied. But the problem is that the system, human system that we have currently is so politicized. That's why you can find a director today, a deputy director today, is still going to feature as who's a politician, will be made deputy director, will be made the assistant director, a thing that never happened during my time when I was a civil servant. So, the recruitment exercise, if you left the process, if you removed all these names of these politicians, you remove it, and just leave the civil servants who don't know the district chairman, who don't know, because as you and I are here on the studio, the district chairman for UPN, they are busy calling the Minister of Health. They are busy calling the PS. Over PS, ndine youth chairman kuno kuchani, kuri mfana wanga bwela uko, ta PS mungazira uke, munga tandizile. Vamene munga tandizile, ndiye ma connections, which the president was telling us politically there that there will be no connections. Let me tell you, there will be connections, because there will be some, there will be some who only maybe finished only last year, who might not even compete with the ones who have been waiting for the last 2 years. But because that one who finished last year has a connection with the Minister of Defense, as an example, Ambrose Lufuma, that person will have a connection to get a job.
So how can we make sure then that these connections really do not happen from the Democratic Party?
It is to stop appointing cadres to hold civil service positions. How do you want to stop connections? For example, how do you want to stop connections, Zipporah, when the PS you have appointed is a UPND, was a UPND district chairman? How do you want to stop those connections when the director sitting at the Ministry of Health is coming from the UPND structures? Meaning, naturally, the system has been undermined, because those ones who will be calling them will know that the one who is there is our person. So while the president will be talking the talk, the real issues that will be happening will be that things will be undermined. And that's the problem. And I think the president maybe will do well to just maybe tell Zambians the truth that you can't talk about my connections zero before you do an assessment. First of all, you should first of all do an evaluation of the recruitment exercise. After you do the evaluation of the recruitment exercise, then you can talk about my connections and non-connections. But if there's nothing like that, why in God's name do you want to begin preempting a system you have not even tried? Why?
Admittedly, the Minister of Health did admit that there are certain figures that are quite disturbing in as far as the recruitment process is concerned. For instance, let's take for instance Central Province, where it was discovered in a speech she gave in Parliament that 161 rural health centers were recorded in Central Province, when officially 121 centers were documented, given an extra 40 ghost facilities that were to benefit from the pending recruitment of health workers. So this is the information that they are putting out there in the public domain so that they can show that this process is quite transparent. Given to the fact that Car added on, when you're having to apply as a person of going through the, who's in the health sector, you need 2 letters, one to the director and the other to the district commissioner, so that if anything comes up, you have 2 evidence. Don't you think that's enough of transparent evidence that the ministry is showing to make sure that these loopholes are quite worked?
But you see, I'm laughing at what you are saying. And when you say one to the DC, one to the director, because you are seated here drinking tea in the studio, when these things are happening in their real life, even if you give the DC a copy, how many times when I was member of parliament, how many times when I was MP, did they give me a copy of the application they had done to get recruited? And when the recruitment exercise started, they were not picked. I had to make follow-ups myself and say, but this person also applied. And you find that there will be I think when you go to Ministry of Health, you'll find, I think there's a whole room like this, full of applications. Full of applications. Because we have had a time.
I think actually by the entrance, when you go, they've been falling. Have you ever been to the Ministry of Health? Alex?
Yeah, I should have
Just by the entrance, the applications are falling there.
I've been there.
You should go there. Now, if they are falling like that, and then the DC's office also they are falling, and these DCs you have who like politics, instead of him concentrating on those applications you have given him, is a DC wants to get also chitenges, that when the president is arriving at the airport, he goes for the by-election as well, and that kind of stuff. What time will he have? What interest will he have to look at your CV? You know, maybe because, you know, you are lucky. You are lucky that you are at an institution like this one where you are the man of God at the helm of things. Because here things are supposed to be done the right and proper way. You are lucky that your application you can even follow.
Imply, Mr. Kalaba, that the issue to do away with corruption and also connection is almost impossible.
Look, they will not do away with it because they are the ones who have created that system. They have made the system become impossible. Why have they appointed? Why didn't they allow a civil servant who has been rising through the ranks to become permanent secretary? Why? Why didn't the president, who promised us, as he gave us so many promises, the president promised us that he will not appoint district commissioners. They'll come from the civil service. That's what he said. He has appointed DCs himself. He has gone back on his word. That DC you're talking about, whom you're saying you also have a copy, is a UPND member. That PS you're talking about is sitting in that ministry, is a UPND member.
So does this mean when the DP comes, they will not appoint anyone from the DP in maybe DC and all these positions?
The problem that you have had in the civil service, and I've said it before as a civil servant myself, is that the civil service has been undermined. I am talking as a person who has been rising through the ranks, from executive officer up to the level of assistant director. I know that you should leave the civil service untouched. Leave it, let the people grow and become big in the civil service without bringing politicians there. That's the way we'll do it. We'll allow people to rise through the ranks. That's why they are called permanent secretaries. They should be permanent. Even when a minister goes, the permanent secretary should remain. Because they're civil servants. They've got no allegiance to anybody but the system. Quite
profound. Talking of corruption, the minister has also provided and revealed that the ACC will be actually available in all the 116 district to make sure that those citizens who will be having issues to do with the recruitment process can actually, you know, report the cases to the ACC. What's your comment on that?
It's a good attempt that Minister Masebo is putting in place, that the ACC should be part of the process. Thank you so much. But why don't you first of all remove that DC you appointed who is a cadre? Because that's the beginning of the problems. Why don't you first of all remove that PS you have brought who is a cadre and bring a professional civil servant? Because that is the point of the challenge. Because the connection of the UPND part to the Ministry of Health is through a permanent secretary who was appointed by the president because he was a provincial chairman. You think when you get a tiger fish from Zambezi River and take it to Kafue, it will become a what? To become a bream? No, it doesn't work that way. It will remain a tiger fish regardless of the river where you take it.
Okay, so really we've had issues, for example, in the Auditor General's report showing all these irregularities at the Ministry of Health. We also had an incident in 2019 at Zamsa where medicine expired. So maybe going forward, how do you feel issues in the Ministry of Health should be handled?
What you need in the Ministry of Health is professionalism. If the Ministry of Health can listen, there is no ministry I know that has got technical experts compared to the Ministry of Health. The Swedish government is literally sitting in the Ministry of Health because we get a lot of support from the Swedes. The Danes are just seated there. The Americans, the British, most of our cooperating partners are literally camped at the Ministry of Health. That is why, if you remember, there was a scandal before at the Ministry of Health where there was this issue of procurement again. And at the end of the day, our cooperating partners even suspended support. It's because it's a sensitive component Ministry of Health is very sensitive. And so it should be done that things should be done in a very transparent manner. And if there is an institution which you should depoliticize, it is the Ministry of Health. Don't politicize it. Allow professionals to run that ministry professionally. If you allow them to run it professionally, the Ministry of Health will thrive, as opposed to at what we are seeing now. I'm not taking away anything from what they're doing. I mean, they're trying, but again, you are trying, but you are the one who have brought cadres in the ministry. And then you here, you keep talking about the DC, later the DC, the later. Okay. That DC is a cadre. When will you get that?
Okay, so they've said the program will take for 3 years. That is the recruitment process, and we hope they'll be able to even, get to recruit the targeted number in terms of the demand.
Why should it take 3 years?
Going forward, I wanted to come to that. Going forward, do you think 3 years of recruitment process is quite enough, or maybe a short period of time?
Why are you mentioning? You know what they're doing is like talking about. They're trying to dupe the people, trying to blindfold the people. When you say 11,276 jobs are available, one thing you have not told people is that this process is not happening in 2022. This process is it's a continuous process which will end in 2025. Or basically 2026. That's what they're saying. When you say it's a 3-year process, it means the 11,000 will not be recruited. We won't say 11,000, tell you, we won't say recruited this year. Again, next year we'll have 11,000. Again, that's 11,000. No. So maybe this year they will recruit maybe 400. Maybe next year they will say financial constraints.
No, they made it clear they recruited 11,276.
This year?
Yes.
Very good. So if they're recruiting 11,000,
next year we'll be having another, considering the financial aspect of things.
So if they're going to have those 11,276, all of them this year, I told you earlier on that we have to hear what the International Monetary Fund will say, because you and I don't even know the conditions attached to what Minister Msokotwani. If they're transparent, I've been saying we're transparent. If you're transparent, tell us the conditions attached to your qualification by June of the IMF deal, and then we'll be happy. But if you just be telling us semantics, stories, and you will qualify, 11,276 are going to be employed, let them be employed today, and then we see. Because advertising, as I told you in the beginning, advertising is one thing. Actual recruitment and placement is another. We have teachers in this country. They have advertised vacancies, and when it came to recruitment, it never happened. Today, there are teachers right now, as we are speaking, who have even been recruited, but they have never been put on the payroll. Today, as we speak. So, we are still also going to wait for this Ministry of Health. I hope everybody will get placed, everybody will be on payroll, and then we'll say, government, we salute.
We'll invite you for another program after that happens so that you can get to hear your view.
I'm sure if you wait for that to happen and then you invite me, then because it will never happen. It won't happen.
Okay, so maybe as we conclude,
sure.
With the way things are going right now, do you see this problem really, which is affecting our citizens out there, being solved anytime soon?
The president said, contrary to social media reports, medicines are now flowing in. My colleagues and I have taken time to go around, and we are going around to see if indeed the situation has improved. And Zapora will always call you to come and fact check with us, because we don't just talk the talk. We go right in the communities where people are. And I hope the situation will change. So what we have done, to be realistic, is that we have said, let's give it a period of 2 weeks. From what the president said that day when he went to play politics at Ministry of Health to 2 weeks, after 2 weeks from that day, let's see what change will be, and then we'll go to the actual places and see what is obtaining on the ground.
And really, there have also been sentiments from the Ministry of Health saying the attack or so-called attack on the Ministry of Health is actually political. Do you think the matter is political?
Attack on the Ministry of Health? On what?
The same talk about the drugs. There have been sentiments from, we have a story we aired last week where the Honorable Minister was actually saying the ministry feels the matter is a political issue. So do you feel it is a political attack on the UPN, or is it something that is actually happening on the ground?
No, this is not even you and I were at Challenge Clinic. What was political about that thing that we were doing there? That was a question of life and death. That was life and death. This is the problem with our leaders. Because while you are going to Mtendere Clinic, while you are going to Challenge Clinic, then they're busy getting even the medicines. Now they've already started getting medicines from they're already going online, getting from India, they are going South Africa, they are going where their medicines. That is why we have not taken advantage. And I've always said this. We need to take advantage of our geographical position as a country. We are surrounded by 8 countries. This is supposed to be a hub of health tourism. We should have the best health facilities in Zambia. So that Tanzania bese, Botswana bese, Namibia bese, all our 8 neighbors should come here because we will have the best. But instead of doing that, we try to play small politics and score small political goals, which is not correct. I mean, up to now, tell me why was it necessary for the president to move from State House to go to Ministry of Health?
Well,
And begin taking selfies there with people and go to Kanyama Clinic, go to Mrs., go to Chainda, go to, that's why the problem is. No, but this is Lusaka. Imagine this is Lusaka. What about in Monze, in the rural areas? What's happening in Chipata in the rural areas there? In Katete, in Nyimba? I'm sure my chairperson Danton in Chipata is agreeing with me that there's a problem in Eastern Province as regards medicines. If Lusaka can have a problem, because it's like in a house, cook a tea, in a house, in a bedroom where you are running the house from, cook a tea. You don't have the money. You, the parents, don't have the money. You expect the children you are keeping in the other room to have the money. So it's the same. If Lusaka can't have medicines, it is worse. It is worse. Ask Danton in Eastern Province. It is worse. Ask our people in Aga in Luapula. Ask Kafula in Northern. Ask Nani in Central Province. They will tell you that it is a problem. It's a problem.
As we get to the end of our program, what could be your advice
to who?
Both the government and the
UPND administration.
And what could be the roadmap?
But you see, the problem is, even if you tell them, the problem is that, especially my elder brother, President Hakainde Hichilema, you will call him Bali. The problem is that they will not listen. He knows it all.
They have promised that they're listening, government. So,
and your voice is valid.
Listen,
as a stakeholder.
I mean, I hope they will listen to what we are telling them. Let the president
try to do that. Try to advise them.
I am advising the president. Sometimes leave that tie alone. Go to Kanyama. Go to Mandevu Clinic without sirens, without FIMA flag following you. Just go incognito and see for yourself. Before going to meet Madam Masevo at Ministry of Health, you should have done it quietly in the night at Chirenge Clinic. You should have done it quietly at Kalingalinga. You should have done it quietly at 2-3. Then you go and meet her. And when you are hearing and she's telling you things, you'll be able to say, Mr. President, no. Yesterday I was at Kalingalinga, there was no aspirin. No. Yesterday. In that way, sir, you'll be in tandem with reality. Learn this. Understand this. If you don't listen, see you in 2026.
That was Mr. Harry Kalaba, who's the president for Democratic Party, and we've been having him to discuss the health issues across the country, really. And thank you so much for coming through. We appreciate your time. and your
You've been very informative.
I cannot remember popcorns from here.
But thank you for having me.
Yes,
you didn't reveal these types of
stakeholder, yes.
Yeah, but also thank you so much. I think this platform is a very well recognized platform. And that's why we take our time. When you say come at 7, we come at 7 and beat the traffic, because it's important that we journey this journey together. And politics aside, the issue of health is a very sensitive matter. And I want to pray and believe that His Excellency the President and his team will take this thing very seriously. They will remove personal interest in the procurement of drugs and allow the system to continue flowing smoothly while they continue doing their forensic audits. So thank you very much and have a blessed and fruitful week.
Appreciate it. The power.
Thank you.
Yes, so that's it from us today. Earlier we were joined by Mr. Mulwanga Mutale, President of the Biomedical Society of Zambia, who helped us discuss the lack of medicines from the health perspective, and then we're later joined by Mr. Harry Kalaba, President of the Democratic Party, who helped us discuss the same topic from the political perspective. So for us, it's good morning, and see you tomorrow at the same time.